Today on the BARP 50 Plus Half an Hour, we have a visit from Dr. Kathy Ellis, a family physician. Dr. Ellis, what is an NCD?
An NCD is a non-communicable disease. It's a chronic illness. It's a disease which we can't spread from one person to another. And it will include the common things we keep hearing about, like things like high blood pressure, hypertension, diabetes, cardiovascular disease, those kind of illnesses, things that are chronic conditions and things that you can't spread from one person to another.
And how does one go about managing an NCD?
Well, what we try to empower the population is to try to prevent the illnesses to begin with. So that's the best way. The best way is not to have them at all. So we're trying to teach people how to prevent getting these conditions, and the best way, to prevent and in the management, is to adhere to a diet which is advisable in terms of if you've got things like high blood pressure, you want to reduce your salt intake and reduce the foods, which again, lots of fried foods, greasy foods, that sort of thing. We're trying to advocate patients not to have. So if you've already got the diseases, these are things that you must adhere to. But if you were following these tips from the beginning, then you may not actually present with the illness, which is ideal. The other things that we would advocate is exercise. Certainly everyone should be having at least 30 minutes of exercise, ideally 5 days a week. So 30 minutes of cardiovascular exercise, that's walking or running, swimming, anything that's burning calories intensively for at least 30 minutes, 5 days a week. And then for persons who already have the illnesses, what we would also want them to do is to be compliant with any medication that has been prescribed by their doctors. So in addition to the diet and exercise, we want you to be compliant with whatever regime that your medicines that your doctor has prescribed.
BARP